follow-up to Joe Rogan's podcast on chiropractic in the United States.
Chiropractic medicine.
If you haven't watched the first video,
now I'm angry.
Click on the link that just appeared in the top right corner of your screen.
The original guy who created chiropractic medicine was a complete, total bullshit artist.
As it will provide a lot of context to better understand this continuation.
He claimed that he cracked a deaf person's back and restored his hearing. Now, a couple of things could have happened here.
It's important to understand that most charlatans in the health field all have some kind of miraculous story to tell. For example, with essential oils, we hear claims that their creator supposedly cured himself of paralysis thanks to these oils. Similarly, chiropractic claims to have restored the hearing of people who had become deaf. However, there is no scientific basis to support such claims. Furthermore, it's essential to remember that chiropractic did not invent spinal adjustment or manipulation. These practices existed long before chiropractic emerged, and even D.D. Palmer, the founder, was aware of this. Their contribution was to brand spinal manipulation with the concept of a chiropractic adjustment, along with a dubious pseudo-scientific justification involving the correction of subluxations, which today is recognized as non-existent. In reality, what we do is promote movement in spinal segments that may have difficulty moving, which is comparable to mobilizations, muscle strengthening, or other manual therapies like massage.
Either one, there was no actual medical consent given because this person was deaf, so I'm not sure how that came about.
I assure you that informed consent certainly didn't originate with the early days of chiropractic. All healthcare professionals are required to provide you with informed consent, explaining the benefits, risks, and alternatives to proposed treatments. This allows you to make informed decisions about what you truly want to receive. The same goes for medicine, whether it involves antibiotics, painkillers, surgeries, or cortisone injections. You should always have informed consent to make the best decisions for yourself rather than based on the preferences of the doctor or therapist.
2, he didn't actually restore the hearing because there are no nerves in the spine connected to your hearing.
Exactly. There is no nerve that connects the ear to the spine.
They could have disavowed what happened and said, we still have a system by which we can try to relieve pain.
All relevant nerves are cranial nerves, and no neck or back manipulation could affect them. However, this doesn't stop some practitioners from engaging in mental gymnastics.
But no, there are still articles out today that try to claim that yes, indeed, he did restore hearing.
Using scientific foundations to extrapolate a pseudo-scientific process that justifies a cause and effect relationship.
Could you guys just maybe back down on some of the nuttier claims?
It's also essential to remember that logic doesn't always apply in the context of beliefs, especially in the U.S.
But the history of it is so ridiculous, and they try to back down on nothing.
For some, reasoning in this way crosses into deeply ingrained beliefs and logical biases.
And that's not how science works. Science works with the newest evidence.
No matter the level of logic presented, it won't change a thing.
And it tries to figure out what's real and what's not.
It's like those who believe the earth is flat or support the effectiveness of essential oils and homeopathic remedies.
And they try to double down on all the craziest stuff. And
regardless of scientific evidence or logical reasoning, nothing will convince them to abandon their belief. These individuals are like dogs holding onto a stick. The harder you pull with logic, the tighter they clench their teeth.
I think there are chiros that are trying to fix the field maybe and say, spinal manipulation can help with back pain.
I don't know her profession, nor her level of authority or knowledge regarding neuro-musculoskeletal pain, but with this kind of discourse, it's clear she lacks understanding. This may not be a topic she encounters regularly. It's crucial to remember that the most important aspect in cases of pain is respecting the therapeutic values of patients. The discussion that precedes treatment is vital. It restores autonomy, builds trust, and alleviates fears and anxiety. In short, it helps to restore control. Then, if this is combined with patient expectations and other approaches, meaning a multimodal approach, while providing exercises to be done at home, it creates all the necessary elements to maximize the effectiveness of clinical practice.
Through these vertebral subluxations that have never been shown.
Now, what is a subluxation?
All right, so
I'll explain it simply. On one hand, because I'm in chiropractic and I know the pseudoscientific definition that is used in the US, but is no longer employed in Canada. The chiropractic subluxation, in its pseudoscientific version, is supposedly a misalignment of the spine, where one vertebra is displaced in relation to another.
A subluxation, the actual medical term, means that a joint pops out halfway. So you have a dislocation, which is a complete separation of a joint, basically.
This misalignment is said to exert pressure on a nerve, thereby affecting the function of that nerve and causing various problems in the body.
Here, and chiropractic uses it incorrectly.
Pseudoscientific associations are then made, for example, linking the thoracic region to digestive issues, claiming that the subluxation blocks a nerve,
And it causes all your health problems, like your pancreas is malfunctioning because your spine is out of alignment.
interfering with nerve transmission, which constitutes an obstacle to health.
That's never been proven to happen, and they claim that they can put you into a state of health.
According to this perspective, if one removes the interference through an adjustment and puts the vertebra back in place, all problems of the human body would be corrected. That is the pseudoscientific definition.
This was created out of thin air by a guy who is a quack. The origin is not based on years and years of medical research.
Correct.
None of this, all of this came from the 1800s from a guy who was completely full of shit.
Once again, the founders of chiropractic did not invent spinal manipulation. They simply labeled, branded, and publicized chiropractic adjustments. They put an advertising banner over manipulation and associated it with the correction of subluxation. However, spinal manipulation existed long before the emergence of chiropractic, without any connection to the pseudoscientific or religious beginnings of this practice.
Yep, and he was a magnetic healer. Now, magnetic healing, like you can still see at the store these little like knee braces that have magnets in it. Guys, save your money. Just get a regular old knee brace. If you feel any relief from one of those magnetic braces, it's just from the brace. It's not the fucking
or
magnets.
Placebo effect.
Yeah, exactly. Placebo effects are. I mean, the placebo effect is a real thing. You can get some relief from that, but
There are several points to clarify here. First, we're talking about magnetic healing because that is essentially what the founder of chiropractic, D.D. Palmer, was doing before promoting his trademark related to chiropractic adjustment and subluxation.
he was a magnetic healer.
Then transformed magnetic healing into chiropractic adjustment and subluxation, claiming to cure all ailments once again. These two approaches represent different forms of quackery aimed at treating all conditions, often for people neglected by the traditional healthcare system. Next, it's important to mention energy bracelets,
At the store, these little like knee braces that have magnets in it.
which have also been used to claim healing.
Guys, save your money. Just get a regular old knee brace.
Indeed, this falls into the pseudoscientific category as well. When we talk about wearing a bracelet to help us, we're also invoking the placebo effect.
Any relief from one of those magnetic braces, it's just from the brace. It's not the fucking
Or
magnets.
placebo effect.
Whether it's a hug from your mother or the sense of security you feel wearing a piece of fabric on a joint, these are merely contextual factors designed to maximize subjective and placebo relief from your problem. Thus, it doesn't even need to be associated with energy, electrical currents, or anything else. It can simply be a piece of fabric and it will still remain a placebo.
Don't bother.
Which may also account for some of the pain relief from chiropractic.
There's still a lot more to discuss. If you want the continuation, the link should be available now. In the meantime, feel free to send me your comments, questions, suggestions, or if you have any lingering inquiries.